Is anyone suffering from nightmares? I'm Masaki Matsuzaki, a psychiatrist. When vividly distressing dreams occur repeatedly, causing significant suffering, or interfering with daily life, that condition is called a nightmare disorder. It is more common in children, but it can occur at any age. It has been pointed out that people with post-traumatic stress disorder or PTSD are more likely to experience nightmare disorder related to their trauma. The content of nightmares varies from person to person, and the emotions felt in those dreams are not limited to fear. They may also include shame or sadness. After waking up, people with nightmare disorder tend to carry those painful emotions with them into the daytime. In general, dreams are more likely to occur during the latter half of sleep, and people with nightmare disorder also often suffer from nightmares during that time. They may wake up in the middle of the night because of a nightmare, or become so distressed by repeated nightmares that they grow afraid of going to sleep. And it is important to note that sleep deprivation and fragmented sleep can contribute to nightmare disorder. Yes, nightmares and the resulting lack of sleep. They form something of a vicious cycle. To reduce nightmares, in the case of children, sleeping in a reassuring environment, such as having a parent sleep beside them, may be effective.
In addition, antidepressants and a medication called Prazosin have been suggested as possibly reducing nightmares. However, pharmacological treatment is not particularly recommended.
For those who repeatedly have the same dream or a few specific recurring dreams, Imagery Rehearsal Therapy is said to be effective. To be honest, at least in Japan, this treatment is still not widely known, even among psychiatrists. First, write down the content of the nightmare as concretely and in as much detail as possible. Then, rewrite the story of the dream into a more positive version. For example, if you have a dream about falling off a cliff, you might imagine that even if you fall, wings grow from your back and you are able to fly. A story like that might work just fine. Or, if you have a dream of being attacked by a monster, you might defeat it with a legendary sword in your hand, once and for all. And if you have a dream in which you are about to embarrass yourself in front of others, your favorite idol might appear, save you, and bring the story to a happy ending. After writing such a neutral or even happy ending scenario, if you make it a habit to read it and clearly imagine the new ending before going to sleep, nightmares are said to decrease. I mentioned earlier that PTSD often accompanies nightmare disorder. Nightmares associated with PTSD tend to follow certain recurring themes. It is said that by treating nightmare disorder, PTSD symptoms may also become milder. For those who are suffering from trauma, trying imagery rehearsal therapy for nightmares may be one possible option. That's all.